Welcome back to Health Matters. I'm Dr. Mark Castellaw. Our program today is about faith and healing. And my next guest is a chaplain from Baptist Hospital, Reverend Anthony Burdick. Reverend Burdick is the System Director of Pastoral Care at Baptist Hospital, and welcome.
Thank you, Dr. Castellaw. I'm glad to be here.
Now, as you already know, our program today is about how medicine and spiritual issues interact. We've had Dr. Steve Gaines on our program to talk to us a little bit, as also some testimonies as well. How do you see the interaction between medicine and spiritual issues?
Well, they go hand in hand. And in fact, I was listening to Dr. Gaines a little while ago, and he mentioned that Baptist mission statement talks about Jesus' ministry of the threefold ministry of Jesus of preaching, teaching, and healing, which is actually from Matthew 4:23, that says that Jesus went throughout all of Galilee, teaching in the synagogues, preaching the good news of the kingdom, and healing the sick of all their diseases. We live that at Baptist Hospital, and in healthcare, faith-based hospitals all over the country live that all the time. The idea that faith and healing go hand in hand, and Jesus modeled that for us.
Now, Baptist Hospital oftentimes honors spiritual leaders, as they just recently did with Dr. Gaines. He was part of the Spiritual Treasure program at Baptist. Tell us about that.
That was something that we did as kind of a spin-off of our centennial celebration. It came in on the tail end of our centennial. At the end of 2012, we began honoring spiritual treasures in the community, men and women in the community that we felt represented the best of spiritual caregiving. And the vast majority of the folks that we recognized are pastors that we do see making visits in the hospitals and taking care of their flocks.
Well, Reverend Burdick, what do you see as the main job and the main emphasis that chaplains have in the hospitals?
That's a good question. When we are all trained to provide a specific kind of care in a clinical setting, and one of the things that I recall from my training many years ago was that our role is to represent Christ. We're to not just represent, but to represent, to remind people that Christ is there in the hospital. Chaplains tend to be called upon to visit. We visit as many people as we can. We don't just visit people from our own churches, we visit all the patients, or we try to. And a lot of those folks don't have a community of faith. So we have the opportunity to provide ministry and spiritual care for folks that may not have a church.
How important do you see spiritual ministry in people just getting better or dealing with illnesses?
Well, I could tell you story after story, and I know we don't have time for that, but one story that I had in mind today, there was a friend of mine that was there as a patient at Baptist East not too long ago, and I went in to see him and I asked him how he was doing. It was a very serious situation, and he said, you know, I've decided I'm really very comfortable with being here. And I said, well, why is that? And he said, well, it occurred to me that there are just so many people praying for me, and there are so many people praying for the hospital and for the people who work in hospitals. There are people who just pray for doctors and nurses in general. He said, Anthony, I'm sitting in the middle of a storm of prayers here. How could I be in any better place? And he found great comfort in that kind of spiritual medicine, and he did very, very well. He relied on his faith.
Well, what a great, another great testimony. You know, I tell people daily that prayer is more powerful than penicillin.
There you go.
And this is something that we need to live by and realize that we're not walking through this by ourselves.
That's right.
Thank you, Reverend Burdick, for being here today.
Thank
This
you.
is Dr. Mark Castellaw with Health Matters, and we've got another exciting testimony coming up about faith and healing.